It's 2019, a far cry from the dial-up manual world that was the 80s. Now, we have self-driving cars, plant burgers, and electric skateboards. Unfortunately, some aspects of our society are grossly underdeveloped. One vital service that we've failed to keep up with the times is healthcare. In 2015, 1 million people went bankrupt due to medical debt. 52 million Americans say they struggle with medical bills, and the average medical expenses of 65-year-old couples throughout retirement is $275,000, even with assistance from Medicare. So with those numbers in mind, let's take a closer look at how our healthcare system works and how we can fix it. America's healthcare system is a hybrid, meaning both government and private coverage is available to citizens. Nearly 32.9 million Americans have no healthcare, and the average premium for a family of 4 per month is $1,168. The relatively low coverage rate of government programs due to strict eligibility criteria is directly related to the sky-high medical bankruptcy rates. So, how do we fix this problem? There are a lot of proposals, but what we're focusing on is Medicare for All, a plan supported by Democratic candidates Elizabeth Warren and Bernie Sanders. There are many subsets of this concept, but in essence, it is a plan that would expand Medicare coverage to every citizen of the U.S.
On Medicare, I think since my heart attack, which was in 2003, I went to the doctor and they put me in a wheelchair and put me on oxygen and wheeled me over to the hospital, and next morning I was in surgery for a quadruple bypass. So luckily they didn't tell me I was 27 minutes away from death. So. And since then, I've had several surgeries, and it's always been fine. Been treated well and well taken care of, and so it adds up to about almost $3,000 a month, which is I could never ever afford on my own. So it's in that sense, it's been really, really wonderful. Some people I know can't afford their prescriptions, and so they just choose not to take they decide which ones they can live without, in a way. And I think that's dangerous, because although I would prefer not to take a bunch of pills, it's, once you get to a certain age and certain health, you really kind of have to. A lot of people have to choose between eating and taking their, and affording their medication. If I didn't have Medicare, it would be catastrophic. There would be no way I would be alive today without it. Mm-hmm. And so it's saved my life. It's been, yeah.
The current Medicare system is for those 65 and older. It covers most healthcare services except electronic or cosmetic operations. Medicare for All would expand this coverage to all citizens of the U.S., young and old. It would first lower the eligibility age to 55, then 45, then 35, then 25, and so on until everyone is covered. Under Bernie's plan, those who desire private healthcare will still be able to obtain it. Most who raise concerns with Medicare for All's cost are unaware that the government actually spends more money per year on our current healthcare system than what Medicare for All would cost. Presidential candidate Bernie Sanders' Medicare for All plan would cost around $33 trillion by 2031. That seems like a lot, and it is. But the National Center for Medicare and Medicaid Services estimated that our current healthcare spending will be roughly $45 trillion over the same 10-year period. This is mostly because a lot of money formerly used to subsidize private healthcare services will go directly towards patients, aka Medicare, decreasing cost. That makes Medicare for All financially viable for every citizen, no matter what.
Yeah, I'm an anesthesiologist who specializes in pain medicine, and I finished my medical school training in 1992. There was a 5-year residency training period, and then I started my private practice in 1997, and I've been doing that ever since. Well, I'm coming from the perspective of being like a clinical practitioner. So I have a small office and I see patients, they have Medicare. And that whole process is really straightforward with Medicare insofar as that a patient can come and see me without any prior authorizations. On a societal level, I think it makes sense because healthcare is so important. I mean, it determines everything, as far as our, employment, or, our general quality of life, our relationships. I see how it's really the crux of our general well-being is your healthcare. And it is very expensive, it's very complicated, and we all need it at some point. So I think working towards making it accessible, simplified, is really important if we believe in, the principles that this country was founded on, life, liberty, and the pursuit of happiness. Healthcare is really important. So I think it makes sense that we work together to try to find a system that works for us as best as possible. And with that in mind, I think that it would be great for society.
Ultimately, there's no reason to oppose Medicare for All. It's practical, cost-effective, and will help tens of millions of Americans afford their medical bills. Now the question is, are you on board?